Hi there, welcome to this Active IQ podcast. My name is Dane. I'm the Chief Medical Advisor for Active IQ. I'm a fitness professional, an academic, and a consultant physician in sport and exercise medicine. In this podcast today, I'm joined by Jason Feavers. And with Jason, I'm going to be exploring the role of fitness professionals in both patients and clients who have long-term conditions. So firstly, Jason, thanks for joining us.
Thanks, Jane. And Dane, always a pleasure to chat to you.
So before we get started, given this is an Active IQ podcast, we're going to be talking about careers and journeys and qualifications and all of that kind of relevance. So I think it's quite nice to start with just understanding your career to date and how you got there, really.
Okay, yeah. So I came into the fitness industry as a gym instructor. So did a level 2 gym course, got a job working in a gym whilst I was doing my personal training qualification. It just so happened that the gym that I worked at was involved in an exercise referral scheme. So I had the opportunity to do the exercise referral instructor training. Really enjoyed the aspect of the work. So I felt it really sort of motivating enough me to be working with clients with a range of long-term conditions. Really enjoyed that side of the work. Subsequently worked within cardiac rehab and cancer exercise schemes as well. I think I've done pretty much all of the different roles within exercise referrals. I worked as an instructor, scheme coordinator. I ended up managing a citywide exercise referral scheme within a local authority public health team. Left that role to then work for Cancer Research UK on some cancer prevention and early diagnosis work. And my current main role is working for Rethink Mental Illness as a physical activity lead. And that's on a Sport England funded project to reduce barriers to physical activity for people living with severe mental illness, which is an area where there's some huge inequalities and much lower levels of physical activity uptake.
And I think your career is quite interesting because you kind of shifted from the fitness industry into, I guess, a more charity-based kind of with interest around long term. Because obviously you worked for the cancer charity, Cancer Research UK before, and then now you're on the mental health side of things. So how did you make that transition?
Yeah, some of that was actually through changes within the public health team that I was working in. So originally, I took on a job which was predominantly managing the exercise referral scheme. With some changes within that role, it became a much wider sort of health and wellbeing program development role. So there was a sort of few changes there as well. Got really interested in behaviour change at that point as well. I think within the fitness industry and certainly within public health, there's sometimes a desire to sort of to make a change and to do the best for people, but we sometimes go by what seems to be a good idea rather than necessarily having a thorough sort of evidence base behind what we're doing and using theoretical approaches. So I ended up doing a master's in behaviour change, part-time alongside full-time work. And then there was an opportunity came up to work for Cancer Research UK, applying a lot more of that behaviour change sort of skills around cancer prevention and early diagnosis. And I had a strong interest in cancer through the cancer exercise work that I was doing at the time as well.
Yeah. Yeah, no, I think that's it's important because I think sometimes as fitness professionals we forget the broad skill sets that we have and the range of opportunities there are with it. So yeah, no, that's interesting. So for those of you listening, if you are interested, obviously I'm sure you can find Jason on LinkedIn and other places and kind of look at that career journey. But Jason, if we kind of move on to exercise referral, I know we were talking about it earlier, and I think you were saying it's been about since 2002 since you were in the exercise referral space.
That's right. Yes, I think probably similar time to yourself, but I was a little bit older when I came into the fitness industry than you were. So yeah,
Yeah, so
certainly back in those
we've had
days.
2 decades, haven't we, doing it or more. But yeah, so I think maybe just before we talk about the pros and cons and get into nitty-gritty, maybe just for listeners who may be less familiar, tell us what exercise referral is and how the whole thing operates.
Right, yes. So exercise referral, I think I probably just I think in terms of defining an exercise referral scheme, I'd see it as a referral from any healthcare professional where there's a meaningful transfer of referral information. So they're having that conversation with the patient, explaining about the scheme, and you're having that permission for someone to be referred into the scheme. And then the referral is into a scheme where there's a set protocols. So yeah, they've got the exercise referral protocols in terms of eligibility criteria, staff with the relevant qualifications for the different medical conditions working with that type of thing. And so it's where there's that real sort of pathway from the healthcare professional to the exercise referral coordinator, to the instructors within that scheme that are suitably qualified for working with those patients.
Yeah, and as we both know, there's nuances that around the country, aren't there, in terms of the way that operates and what the patient might do with the fitness professional, whether that's gym space or an alternative approach as well. So yeah,
Yeah, absolutely. And I think there's always been those differences in different areas. I think Wales is the only sort of area where it's had that sort of national scheme for the
yeah.
whole of Wales, whereas across England, then it has been very variable in terms of what's available.
And so go on, I guess the $1 million question is, does it work? And in your experiences, kind of what are the strengths and weaknesses of an exercise referral scheme?
Yeah, so I suppose one of the weaknesses, which is the key one there, is I think schemes have never really been that good at demonstrating effectiveness.
Mm.
Um, when I first started working in exercise referral schemes, it was actually administered by the Primary Care Trust. So they had a funded role within the Primary Care Trust that received all the data and that supported the various different gyms that were involved in delivery of the sessions, but also worked with healthcare professionals to make sure they had the relevant information and paperwork to make those referrals. And in those days, there was a lot of information that was then sent back. So we did an initial consultation and quite a lot of data gathering at that point. And then at a 12-week program, a number of different tests and data that was shared with the Primary Care Trust. I think since exercise referral moved more into local authorities, so with the 2013 Health and Social Care Act, that sort of prevention element of it moved into local authority public health. It sort of meant that it was honestly because there wasn't often looking for additional funding or justifying the role that a lot of that data collection disappeared. So I think that is one of the key areas really to sort of demonstrate to people that it is effective, what's working, what isn't working, but a lot of that will come from the data.
Yeah, and I think there's a really interesting point you made there around, ultimately to get funding for anything, you need to have evidence it works, and to have evidence it works, we can't just go, well, physical activity works. We need to prove that the scheme works. And actually, one of the skills that we've been talking about Active IQ is that ability to run basic research or basic numbers to understand, is what you're doing making a difference? And if not, and we think that may be a challenge in itself, then there are lots of universities with master's students who are chomping at the bit for projects that probably people working exercise referral schemes probably need to engage with as well. So yeah, definite opportunity there, isn't there?
Definitely, yeah. And I think one thing that's worth adding there as well is that I think in the past it was too much about trying. It could be argued it was too much about trying to demonstrate to the primary care trust that it was working, and that some of that data wasn't particularly relevant for the client. I
Yeah,
think there is getting that balance between how you demonstrate to the client that they're improving and that they're getting benefits from it is different to some of the data that you will be sending to funders within that as well. But I think where we are missing is demonstrating to healthcare professionals why they should be referring into the scheme and that it is working. I think a lot of that is anecdotal conversations they have with patients afterwards, rather than the
yeah,
schemes actually demonstrating that for themselves.
yeah, yeah. No, good points, and maybe one we need to pick up again as part of our kind of active IQ education. So, kind of, I guess, talking a little bit about the bits we talked about exercise referral, but kind of, given the kind of prevention agenda at the moment in general, where does exercise referral fit into that kind of wider prevention health agenda?
Yeah, so I guess really good question. I think traditionally, and in terms of the protocols, the acceptance criteria for exercise referral, it's thought of as some exercise for the management of a range of long-term conditions rather than prevention. So in some ways, the prevention element comes from stopping those conditions from getting worse and developing into other things. So I think that's a key part
Yeah,
around that. I think as well in terms of where the advice to people might be just to move more, then that's great advice as long as people are getting the support to do that for prevention. Whereas once people have actually developed a long-term condition, there's additional barriers, and it's looking more at what the most effective exercise is for helping people to manage that condition, whilst making sure that it's safe exercise as well.
Yeah. So, and it's that age-old debate, when do you need to see an exercise professional with the skills versus when is it just about getting you moving more? And obviously the more complex something is, the more skill it needs, I guess. So no, that's interesting. And the other point you picked up, which I think might be worth just clarifying for users, is listeners, is that kind of primary versus secondary prevention. And you're very much talking about exercise referral being conditions that get referred in. So we're really talking about secondary prevention, and we're stopping that disease progression. And as you said, high blood pressure becoming a cardiovascular disease issue versus some of our other stuff's that primary prevention piece, isn't it? Stop you getting the condition in the first place. So no, that's really useful. And I guess if we take those two elements and kind of move that forward, we talked about where exercise referral as a scheme fits in. But what about fitness professionals? So you've got an exercise referral qualification or the new diploma in long-term conditions qualification, and where else could you work or be of value? Like where do you see the value of them in a healthcare system?
Yeah, well, I think certainly within the fitness industry, within gyms, leisure centres, studios, I think so many people that are coming along to everyday classes have at least one long-term condition. So it's a really important skill set for anyone working in the fitness industry with clients, to understand the implications of different long-term conditions and to be able to support people effectively within the classes with that.
And if you're kind of going outside of the fitness industry and talking about the healthcare system in general, do you see a role for fitness professionals with exercise referral in, I don't know, it could be primary care or secondary care? And if so, like in your opinion or hypothetically, what could or should they be maybe doing in these areas?
Yeah, I suppose one thing is that the landscape has changed so much, even just over the last few years.
Mm.
So within primary care networks, there's now NHS funded roles in some areas for health and wellbeing coaches. A lot of local authorities have health trainers. So there's roles that are given quite high level training around behaviour change and being able to support people to make changes around a range of health behaviours, potentially including physical activity. To me, I think where the fitness industry comes into it, and a fitness instructor is much more about how they support people to be active. Particularly where it's down to that programming of physical activity, where it's that programming side of things, which is really important
Yeah.
for that.
And we talked about obviously that qualification as such, but if you were someone in the fitness industry looking to expand and focus more in that long-term conditions space, what kind of other skills are worth picking up, and where might you do that really?
Right, yeah. I guess there's two key areas really. So I think I'll talk first about developing those skills around different long-term conditions.
Mhm.
So I think and we talked before about what the opportunities are within the NHS. In some areas, there are instructor roles within NHS trusts. Some of those need a level 4 qualification. So quite often they advertise for someone with level 3 plus at least one level 4 qualification to be working within some of those roles within hospital trusts. Some of that might be very specific if it's supporting on a cardiac rehab setting. There's a lot more around cancer exercise, particularly prehab. So you're just working with people in those sort of very early stages before surgery, and a lot of evidence now around the benefits of even just a small number of weeks of physical activity ahead of the start of cancer treatment. So I guess some of it is if instructors have a particular interest in certain conditions,
Yeah.
to improve the awareness, the knowledge of those conditions. So you're looking at the qualifications and CPD that's available to expand that knowledge. the other side of it, so I sort of class that as the hard skills almost. The other side of it, and I think it's going to be no surprise to you at all that I sort of mentioned this one, is
Mm.
improving behaviour change skills.
Yeah, yeah, not surprised at all. So, go on. I think changing behavior is always an interesting one, isn't it? Because everyone talks about it. The soft skills are important. We spend a lot of time in medicine learning it. Um, but it's a tough skill to crack, isn't it? Like, so I guess what is it? And the other terms thrown about are things like motivation interviewing, aren't they? So what is all of that in terms of the key definitions and the key things you need to be aware of? And then from your point of view, kind of how do you get good at it?
Right, yeah. So if I start off addressing that question about motivational interviewing, and that is a really key skill. I guess one thing that distinguishes motivational interviewing from a lot of the other behavior change models and techniques that we come across in the fitness industry is that it's an approach. So it's learnable, it's adaptable, rather than being a specific model or theory. And again, it's interesting how that's changed over the time that I've been involved in exercise referrals. So back in 2002, Miller and Rolnick were sort of the originators of motivational interviewing. They used to describe it as a method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. So they talked about that ambivalence where people are sitting on the fence about you making a change or not to a particular behaviour. They've relaunched their sort of main book guide to motivation interviewing last year, around about this time last year, I think it was. And it's really encouraging that they now talk about motivational interviewing as being a way of talking with people about change and growth. In order to strengthen their motivation and commitment. So I think whereas before we'd often think about motivational interviewing as something that was used when people were at that sort of contemplation change, if people were of stages of change model, whereas now it's very much been seen as part of those ongoing conversations that we have with people, that it's not something just in that initial consultation or those first sort of few weeks. It's something once people have actually made that change that we continue to help with that change to be embedded and to help people to grow as well.
Yeah, no, that's interesting. And taking that forward, so we all know it's important and a skill in itself. It's easy to tell everyone to be more active, but it's hard
Mhm.
to get them to actually do it. So if you're a practitioner or an exercise professional trying to learn this skill, where would you start and how would you get to being a hopefully a competent, confident practitioner?
Yeah, so like anything really, it's getting that initial learning. A lot of the techniques used within motivational interviewing are sort of very easy to sort of to utilize, and it's just practicing them. So it's been able to sort of practice those skills. I did a 2 day workshop, an intermediate workshop with Steve Rolnick over in Cardiff a few years ago. And even then, yeah, I wouldn't consider myself to be an expert in motivational interviewing. Um, it's just about having those skills and constantly applying those as you work with people. And I think the key thing it's about listening. It's being present when you're having those conversations with people. So we always talk about person-centered approaches
Mhm.
and listening skills. And it's just applying that
Yeah.
using some of the skills within motivational interviewing to sort of to demonstrate that we're listening and to sort of to check that understanding with people and it's sort of to build that empathy as we work with people.
Yeah. And any resources that you'd recommend people go and have a look at, or videos, e-learning, books, anything that off the top of your head is of value?
Yes, I guess the sort of the Bible for motivational interviewing is Miller and Rolnick's motivational interviewing
Mhm.
book. So I think that would be a key one for people. Um, there's some courses that I'm developing myself that are looking more at bringing in also elements around positive psychology and goal setting, which I think is something that we focus a lot on goal setting within the fitness industry, but we don't necessarily apply it in a particularly effective way.
Mhm.
So you're looking at some of the behaving change techniques around how we reflect with clients on goals and look at again that growth element to it rather than just looking at what someone wants when they first come along to the centre without looking at how that evolves over time, and also giving people those skills to be able to reflect on goals themselves.
Yeah.
So it's that sort of journey, and how a fitness instructor can help support people on that journey and help them to become independent and to sort of be able to do those things themselves.
Yeah, perfect. Okay. The other one, probably just to let listeners be aware of, is moving medicine has got some good motivation into doing resources kind of linked to conditions. So if you haven't seen Moving Medicine, it's movingmedicine.ac.uk. And if you go on it, you can click on a condition. It'll ask you how many minutes you've got to spend with the patient or the client. And it uses a kind of behavior change framework to talk you through that condition, what the evidence base is. So things like, how confident is a patient at this point in time? How could they move from wherever they tell you to wherever they go? It's got a little bit more information about maybe advice for that condition. So again, another resource worth having a look at too, that hopefully will nicely complement the Rolnick textbook as well. Perfect. And I guess kind of final question for me, really. So kind of look into the future. Where do you see exercise referral or providing physical activity for long-term conditions going? What's the future look like in this space?
Right, yes. I think there's so much going on at the moment, and it's all looking. I think the big piece of work at the moment is understanding what's most appropriate for an individual client. So it's letting people have information about what's available, and then being able to look at different things and what's going to work best for them. But also, I think for healthcare professionals to sort of be able to sort of guide people towards what is going to be most appropriate. So I think for me, one of the key strengths of exercise referral schemes is it provides that really supportive environment for people. There seems to be a bit of a shift towards having a real emphasis on physical activity guidance for people living with a long-term condition. And that's something as a physical activity lead within a charity, we do a lot of work on that around making sure that people know how they can sort of exercise safely, with the effects of the medications, those type of things. I know a lot of the other health charities that are involved through the Richmond group of charities are doing a lot of similar work. And again, I think also within the healthcare settings as well, there's a lot more information. You mentioned about moving medicine, and a lot of resources available to healthcare professionals there around physical activity guidance for long-term conditions. I think there's a danger that just providing people with knowledge doesn't necessarily translate to that person then making an effective change.
Yeah.
I know we've talked a lot in the past from a more sort of an education and training perspective about that knowledge doesn't necessarily give you skills to do something. That comes from applying that knowledge, and ideally in a safe environment where you're getting feedback on that application of the skills and the knowledge. And I think there's a similar thing within fitness. So just because someone knows what they should and shouldn't be doing with a long-term condition doesn't mean that they feel confident doing that. And so I
Yeah.
think working over a period of time with an exercise referral qualified instructor really helps people to gain that confidence, that they are doing the right things, that if they're told to work at a moderate intensity, am I actually working at a moderate intensity? Am I doing this exercise right? Am I going to cause any problems doing it? So it's having someone to work within that supportive environment, which is really important. And I think as well, there's been a bit of a shift towards group exercise within exercise referral schemes as well.
Yeah.
And for some people, working with people that are in a very similar position or even with a similar long-term condition can be so empowering for people. So I think those are sort of some of the key strengths really of exercise referral and how that fits in.
Yeah. No, that's interesting. No, thank you. Thanks so much. And I think one of the points you made was quite interesting around there, just because you know doesn't mean you do. And it's a great analogy someone was telling me about, which or the example being the 5 a day. Nearly everyone knows the 5 a day, but that doesn't mean everyone does the 5 a day. And physical activity is a little bit the same, isn't it? Some people know they need to move more, but that doesn't mean they're going to, and we need to change that behavior. And that's the patient. If it's the healthcare professional, sometimes we're trying to plug the gap on knowledge. So as you said, moving medicines there, We also have the Physical Activity Clinical Champions, which is an education program, as you know, for healthcare professionals nationally. So for those of you listening, if you haven't come across that, again, worth having a look. So there's lots of investment at the moment going on to educate healthcare professionals to make sure they understand the power of physical activity, which for me feels like there's a great opportunity for the fitness industry to then meet the, I hope, extra demand that comes from patients and healthcare professionals valuing the physical activity space. So I guess watch this space and keep an eye. But I think, with the big prevention agendas now, I think now is our time in the fitness industry space to really take hold of the long-term conditions space. Jason, any other final comments from you before we close up?
I think the only other thing just worth mentioning, and again, some people listening might be already aware of some of the more app-based programs that are coming out. So things like Good Boost, which is I know a number of leisure providers are incorporating that. And again, I think it comes down to that patient choice around what they feel is going to be best for them. Do they want something that's more app-based and less interaction, maybe with an instructor or other people, or is that interaction really important?
Yeah.
And I think when we look at things like building rapport, empathy, we know that people who need that additional support are going to get that more from working with an instructor. Whereas for people that feel that it's more about some of the guidance and something where they can just be left to get on with it, then some of that new sort of tech approach could be really, really useful sort of addition to the exercise referral world as well.
Yeah, perfect. We'll try and collate all of these resources and share them with you as well outside of this podcast. But otherwise, Jason, thanks so much for your time. Really appreciate it and the chat. And for those of you listening, I hope you found the video insightful and useful. And we'll see you on the next one.